Hi, good evening, everyone, and thank you for joining us this evening. So I'm just going to give you a bit of an overview on the program that I coordinate, which is the Bachelor of Health Sciences. So to get you to understand what the program is really all about is in 2015, the university recognized that the Caribbean needed to have persons trained in what is called um, up allied health services. So you will typically hear about doctors, nurses, dentists when you think about healthcare professionals. But what you have to appreciate is that a system needs to be created in order for all those persons to practice in. So somebody needs to determine where you put hospitals. Somebody needs to determine how you run a hospital. Someone needs to determine what is best in terms of the population health. Somebody needs to determine how do we manage information and leverage information in order to make good decisions to support clinicians and good decisions to make sure that the overall health of the population is as good as it can possibly be. And that brings me on to the concept now of a health system. And basically, what a health system is all of the persons, all of the institutions that are involved in the promotion, maintenance, and improvement of health throughout the life course of throughout the life courses of individuals. The program was started in 2015. It's a pretty exciting program. We've been here for approximately 6 years. We've had students who've been graduating with first class honors and upper second class honors, and being able to go on to practice at different universities, go on to continue their studies at different universities. Universities such as Oxford, you may have heard of Oxford in the UK, the University of the West Indies, because we have a wonderful Masters in Public Health program that you can enroll in after the successful completion of your Bachelor of Health Sciences. And you have also had persons who've gone on to the University of Brighton and Sussex. So, like I said, you can come into the program, you can do the program, but there's also scope for you in terms of your postgraduate education. Dr. Kohol, can you put up this slide for me, please? So there are 6 concentrations that you can do in the Bachelor of Health Sciences program. The first is Health Informatics, which is a program that we had done some work on recently and is a very exciting program. And for those persons who understand that you need information and information is the basis by which you make decisions, will be interested in a program like this. So a health informatics specialist, sorry, would be concerned with how do I gather all the relevant information inside the health system so that persons who are making decisions can make the best possible decisions. And the decisions have to be made on the basis of using the currently available information. We also have a concentration in healthcare administration and management. One thing that you can appreciate, and because of coming out of the COVID-19 pandemic, and you've heard all the time, people talk about overwhelming healthcare systems. How are we going to be able to run our healthcare systems and provide all the services that are necessary for persons? Well, an administrator who has an in-depth understanding and knowledge of the how peculiar health systems are and the decisions to make, those are the persons who are needed to make sure that the health systems function properly and that they're administrated properly. We also have a concentration in environmental science. So persons who are very passionate about the environment, very passionate about how small island developing states like ourselves manage our resources, how we do environmental impact assessments and make sure that however the population chooses to do business or how we choose to exploit other industries, that we're doing so in a sustainable manner. So people who have a very keen interest in the environment and the maintenance of the environment are maybe inclined to do that concentration. I've spoken to you previously about the importance of using data and making decisions on the basis of information. One interesting thing about the Caribbean is that we are a very unique kind of peoples. Our region has very peculiar characteristics relative to, let's say, North America and Europe. So you may ask yourself, how does a doctor, how does a nurse, how does a dentist, how does any professional make a decision on what is best for us? And one of the key things that you can look at is the fact that you need to do research. And the research has to be done in an ethical manner. It has to be done in a way that it benefits the population, doesn't do any harm. And there are certain guidelines that need to be followed. So people who are keen on conducting research and also keen on making sure that all of the necessary guidelines are followed can pursue our biomedicine and ethics concentration. And that would be really of good benefit and use to them and also to the Caribbean in general. We have a concentration in community health. And community health is basically an offshoot of public health, where you are interested in the total health of a population. And you get to learn lots of interesting things like epidemiology, biostatistics, the principles of public health, and to be able to apply those principles to make sure that you are improving the health of your population. And last but not least, we have a concentration in dietetic, nutrition and society. The Caribbean has a very high incidence of chronic non-communicable diseases. We all know this. And an important part of controlling these chronic non-communicable diseases is diet. So people who are very well versed and understand the role that diet plays in the treatment and control of these diseases, that person may very well be interested in taking a concentration in the Bachelor of Health Sciences. So like I said, Dr. Cohol would have given a wonderful introduction to the medical school. But the question you must ask yourself is, how do all of these people, how do they practice? What is the system that needs to be set in play for them to function effectively? And the maintenance of our healthcare system was important, and that is why the whole Bachelor of Health Sciences program was conceptualized. So after completion of your program, you might ask yourself, what are the available options? So you have two general options. You can go on to enter the workforce. And like I said, you can do things like health promotion. You can go in as an environmental health officer. You can go on to specialize and be a member of an ethical or an institutional review board. And those are persons who are responsible for making sure that all of the necessary ethical guidelines are followed as it relates to research. You can go on to be a health informatics specialist as well. And these are just a few of the areas that you could potentially go into. However, what I would like to point out is the fact that you can also go on to continue your education. And we said before that the University of the West Indies has an excellent Master of Public Health program. I can attest to this. And you can also go on to pursue your studies internationally. And I've mentioned places like the University of Oxford. Our students have done quite well. Some of the students have won the Arnold Cato Scholarship. They've won the Johnson & Johnson scholarships. And I can tell you it's a very exciting program, and there are lots of opportunities. And the decision really has to be, am I going to enter the workforce one time, or am I going to continue my passion for what I've now learned and kind of build on those things? And if you desire, you can go on from your master's and go on to do your PhD. So I know you guys may have a lot of questions afterwards, but thank you very much for listening. And we'll be looking forward to seeing you in the program. Thank you.